Everyone. So today we are going to start with the congenital lesions of the nose. That is a topic of ENT. So first of all, there is coanal atresia, which is a congenital. So let's begin with it. So during the development, the primitive nasopharynx it is separated from the primitive oropharynx by membrane known as nasal membrane, and the nasopharynx starts communicating with the oropharynx. This usually occurs normally, but if there is a persistence of the bucco-nasal membrane, so which leads to the incomplete communication or non-communication of the nasopharynx with the oropharynx, this condition is known as choanal atresia. So, what are the risk factors? So, the more it is more commonly seen in the children born to the hyperthyroid mothers who took methimazole or carbimazole during the pregnancy. It usually occurs unilateral or bilateral in the ratio of 2 is to 1. It may be bony as well as membranous, but in if it is unilateral, if it will be asymptomatic, but if it is bilateral complete, then the children will be born with the respiratory distress, and in such cases nasogastric tube does not come to the oropharynx. So as we know that the infants are obligatory nasal breathers during initial 3 to 5 months, so the child is normally normal while crying but develops cyanosis and breathlessness if in this case. In the management part, there is wide bore feeding nipple is inserted into the mouth, which is known as McGovern's technique, and some associated symptoms which we will be remembering with the mnemonic charge. C for the coloboma of the eye, and H for heart abnormalities, atresia of nasal cone, and retarded growth, and genital and ear formation. And investigation should be done through the CT scan, and the management part is initially McGovern's technique, later transnasal endoscopic excision, and later uh, post surgery mitomycin C is inserted to decrease the chances of the re-stenosis. As we can see there in the diagram, there is primitive nasopharynx, and after that this is the bucco-nasal membrane which remains persistent in this choanal atresia. Next one is nasolabial cyst. So it is a non-odontogenic cyst which is epithelial inclusion cyst which is extraosseous and is located in the region of the nasolabial skin fold, and it may arise from the entrapped epithelium at the site of the union of the medial and the lateral nasal process and the epithelial remnants of the nasolacrimal duct. It is usually present since birth and may be present as unilateral and present as swelling in the region of the nasolabial fold, and the management is through the excision by sublabial approach. Another lesion is encephalocele, that is congenital condition where midline defect in the base of the skull which leads to the herniation of the intracranial tissue like meninges. Most common is location is the occipital followed by the frontal, and the frontal encephalocele present at birth as subcutaneous trans-illuminating and the bluish soft pulsatile and compressible masses at the root of the nose near glabella. In this encephalocele, we usually do first and birth test. In this, the mass increases when the child cries or coughs, and on bilateral internal jugular vein compression. Okay, an investigation for soft tissue, it is MRI are better, and the bony details CT is to be done. And the treatment part, it is to restoring functional brain tissue in the cranial cavity and also performing dural repair and reconstruction. Okay, thank you guys.